You talked about a child dying of an infection that was caught. We know that supplies getting in are extremely limited, less now than they have been in the past. Can you talk a bit about the challenges that you face because of the lack of supplies? How does that manifest itself when you're trying to do your medical work?
Yeah, I mean, so I remember one Saturday night operating on an 8-year-old who was bleeding to death, and I asked for a swab, and they said, no more swabs. We had operations being done with no sterile gloves, no sterile drapes at various points. We had lack of basic equipment. I did amputations on people who just had to take paracetamol after the operation as pain relief. That medical aid was sitting at the border and not being allowed in. We were not allowed to take any medical equipment except for personal use. So I was asked, could I bring thyroid medication for some people? Couldn't take it in. That's a deliberate policy. And that's changed because I know that teams earlier in the year had been able to take some medical equipment in. So again, that seems to me to be a deliberate restriction of medical supplies. And basic things like soap, shampoo, that's not being allowed in. I saw, I don't know how many wounds with maggots in. One of my colleagues took maggots out of a child's throat in intensive care. There were flies in the operating theatre landing in the wounds. It was appalling, and that's a deliberate choice. It's not an accident.